So we welcome you to the Health and You Community Wellness Series. So I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health and also an Associate Professor of Clinical Population Health Sciences. So a very warm welcome again to you from the Institute for Population Health. Thank you for joining us today. Just as a reminder, the overall goal of the series is to create community awareness about health and disease. And our ultimate objective is really to enhance self-care, reduce suffering, and improve the quality of life and increase healthy longevity. Just some housekeeping rules. Your cameras and microphones are turned off. Please use the question and answer feature, the Q&A feature, to type questions or comments. We'll address the questions at the end of the session. And just a reminder that this is not a CME CPD activity, so no certificates of attendance will be issued. So today, as you all know, since you all have registered for the event, we have a fantastic discussion which is going to happen today. And the topic is the runny nose in children. What does it mean? So the session will describe the causes of runny nose among children, recognize the warning signs, and discuss preventive measures and best practices to support children. So our speaker for today is Dr. Amal Khidir. So Dr. Amal Khidir is an associate professor of pediatrics. She's the vice chair of IRB and pediatric clerkship director at Weill Cornell Medicine-Qatar. She is American board certified. She's a fellow of the American Academy of Pediatrics and section of International Child Health, practices pediatrics at Hamad Medical Corporation and Sidra Medicine, and is a co-leader of research and scholarship collaborative in Council of Medical Students Education in Pediatrics, COMCEP. So her areas of interest are professionalism, professional development, assessment, health promotion, and cultural competency. She's the co-founder of the professionalism program at Hamad Medical Corporation. She's led and conducted several national and international professional education workshops and earned several teaching awards and the COMCEP 2021 Research and Scholarship Award. She has also been the recipient of several grants from NPRP. So please join me in welcoming Dr. Amal Khidir. Dr. Khidir, very warm welcome to you and thank you so much for joining us today.
Thank you, Dr. Shima, for the kind introduction, and it's really an honor and pleasure to spend the evening with you all. And I hope you find this talk helpful to all the participants. Okay. So I have nothing to disclose, and we're going to talk about causes of the runny nose, also recognize the warning signs, and discuss how to support the children, and basically also to support the parents of the children. Okay. So I'll start initially with the structure of the nose itself, because once we have understanding of that, things hopefully it will make sense as we move forward. So in this sketch, and all of this I took it from public space. This looking at the nose from the side, you see only the external part, but as you know, there is a cartilaginous septum between the two openings, and when you look inside, these are layers, we call them the turbinates. These are like small kind of swellings naturally there. It has a bone and then covered with a mucous membrane, and it is it's where the air goes through this, or rubbing through this inside the nose. We call them turbinates. And if you look at it from in a cross section, this is how it looks like. Okay, so this is the passage of the nose. So if you can imagine, if they are swollen, that's what causes the nasal block. And if there is any trauma to the septum, sometimes the kids fall or get hit by a ball and they have the septal deviation, it makes it narrower. And also, if you have any inflammation, if you think about it, this area here, this is how it looks. This is magnification of the same area here when it's healthy. But if there is any infection or inflammation due to allergies on others, this little swelling here, it gets bigger and wider, and it blocks completely the entry of the air which is basically, it will almost touch the septum, okay? The other thing I want to share with you, that the oropharynx, which is the back of the throat or the pharynx there are 7 things or 7 openings related to it. 2 from the nose, then the throat, and then you have 2 tubes coming from the middle ear. We call them the Eustachian tube. And then all of them enter into 2, the breathing pipe up front and the esophagus where the food goes. The reason I'm mentioning that, because as we go along, if they have a cold or allergies or inflammation, all the mucous membranes there swell. So the drainage of all these fluids becomes a little bit harder. The other thing I want to share with you, remember I showed you the terminates. It is covered by a mucous membrane, and the mucous membrane is basically a group of cells, and it has some mucus producing small glands. And the cells, this magnification, it has small hair here, we call it the cilia. The goal of the cilia is to prevent dust from going inside, and also by its movement, move that mucus that several times or always produced, go in the back of the throat and get swallowed. The issue is if we have too much production of this mucus, that's where it comes running up front. The other piece related to the anatomy, I want to share with you the sinuses. So the sinuses, and this is an adult. For kids, it's smaller because not all of it is well developed, depending on the age of the child. And the sinuses is basically like pockets of air, a space within the bone to make the skull lighter. Otherwise, it will be very big, dense, heavy piece of bone. And the sinuses, there are several, almost 4 of them. There is the frontal, which is up front here. And then this is on the side, this is up front. And then you have also the ethmoidal and the sphenoidal, not all of them very well developed in kids, but the biggest one is the maxillary sinus. And as I said, depending on the age, it's the maturity and how big the space is. And as you see, it is connected to the nose. To make it more clear to you, this is where most of the people suffer with sinusitis. Remember, they say we have like pain in the face and heaviness is because of this small pocket, this axillary pocket. As you see, it's also connected with the nose. So if you imagine there is any swelling here or excessive secretions, it will block the emptying of this sinus. And the sinus is also covered with the mucous membrane, which also produces mucus. So if there is an excessive production of the mucus and there is not enough of drainage, this will be all stuck here. And as you know, stagnant water leads to infection because bacteria will come just land there and cause infection. Okay, the reason why we're together today, because depending on the age, that runny nose can cause several problems. The other piece I want to share is because babies are obligate nasal breather. That means they only breathe through their nose. They don't know how to breathe through their mouth. So that's why if they have a blocked nose for whatever reason, they vomited milk or they have a cold or whatever in the nose blocking it, they become very irritated and they start crying because you cannot have the mouth is closed and the mouth is closed. So when they cry, they feel better because when they cry, they take a deep breath and they feel the air is coming in. And that will affect what? The feeding too. Okay, so because when you feed, you put it in the mouth, or if you have a pacifier or the breast in the mouth and the nose is blocked, then the baby cannot breathe at all because the nose is blocked with secretion, the mouth is blocked with the food or the nipple or the pacifier. So sometimes they have difficulty to eat, they push the breast out or the nipple and they cry all the time and get fussy. And that's why we felt this topic is important because it's a nightmare to the family and to the kid and everyone, and we need to figure out how to help them. The same thing, they cannot blow their nose, especially the younger one. And this leads to the misery of the kid, the misery of the family. Mommy can't sleep, the child can't sleep, and it becomes a chaos. So moving forward, we need to figure out what caused it, how we can handle it, and how maybe we can prevent it to start with. So the color of the nasal discharge can be from clear watery, okay, can be thick mucoid, it can go yellow, it can go green, and in some instances it can be blood stained, and this blood stain can be due to trauma, either trauma from outside or picking their nose. The runny nose can be associated with or without fever, with or without cough, okay, ear tugging, fussiness, restlessness, or disturbed sleep or change in feeding. And a few things I want to highlight here, And as we go along, because I'm going to discuss the main reasons, the ear tugging is not always ear infection. Remember, I told you the oropharynx has the two-eustachian tube from the ear draining normally, naturally into the pharynx. So if there is any block due to inflammation or cold, that fluid is not pulling. So it accumulates in the middle ear and it causes a little bit of irritation. We call it ear effusion. So the ear effusion even can cause some irritation. Again, if the nose is stuffy and the kids are laying down, all that junk goes into the throat. And when it goes into the throat, they cannot breathe. So that's why they might cough early in the morning, they might cough at night because all of it in the back, or they will have restless sleeping. Okay, so that's what we mean by disturbed sleep and also disturbed feeding, as I mentioned earlier. So the causes of runny nose, it can be a cold, which is an infection, and we'll discuss it further. It can be allergies. It can be due to sinusitis, or maybe a foreign body in the nose. You know, kids like to stick things everywhere, right? And if you have a nasal discharge from only one nose, that's like a red flag. There's something going on, either foreign body or something else happening in that only one nostril, okay? Also, naturally, we produce tears. Tears are made to protect our eyes, all our eyes, all of us. So we always produce tears, but we don't cry all the time. You don't see it because naturally there is a tube between the eye and also the nasal cavity. So that's normal. Every second produced tear is absorbed there. You only see it when we cry and produce more and then it floods. The same thing when people are crying or having a lot of tears, you also see the nose is running is because it's connected there. The other thing I want to mention, there's some fertilizer, the organophosphorus. Sometimes when kids get to it or adults, everything will be pouring, like the tears, the nose, and the diarrhea, vomiting, all, like my friend said, all the faucets will open. So also you have to figure out why does the kid have a runny nose, okay? So these are just example of the reasons. So we're going to talk about the cold, okay? So we call it also the upper respiratory tract infection because the cold is mainly related to viruses, and there are a group of them. It might be with a fever or without. It's not always with a fever. It mainly congested sometimes and stuffy nose, but sometimes all the way you might have excessive secretion, then you have runny nose. It can either be clear in the beginning and then turn into yellow or green. And the yellow and green can happen maybe once, twice a day. And sometimes when they sneeze all that junk with the color. And the color is basically means long-standing kind of secretion. They may or may not have a sore throat or hoarse voice or a cough. And usually there is a sick contact. But don't get tricked with that, because sometimes if the baby never left the house, but he has siblings who go to school, the other siblings who are older have been in school for some time, so they might be around viruses and others. They don't show the symptoms because their immune system is ready for it. So they bring it home and the little baby will start to have infection. Some mom noticed this when the school starts, the little baby gets to struggle a bit. The other thing, even the baby when go new to the daycare, I usually tell the parents, don't be surprised. For the first maybe 6 to 9 months, the baby will be sick every week to the other. That doesn't mean we keep them home. We just need to support them. And the reason is as they learn also vocabulary, they learn to get to adjust to the viruses in the community within the daycare, especially if it's a daycare of group of kids. It's not like going only to the babysitter and coming back, okay? So that's what I mean about sick contact. It can be obvious, mom has a cold, dad or brother, or maybe nobody is sick, but they got it. The causes, as I mentioned, the most common causes are viruses. And because it's viruses, there are a bunch of viruses. Many of them, some of them cause a simple cold, others might get more complicated all the way to pneumonia. But most of those viruses, it's a self-limited kind of illness for the cold. But with influenza, sometimes it gets worse. And we're going to talk about influenza shortly. And although it is self-limiting, it takes 3 to 5 days and it goes away. Sometimes get complicated again with ear infection or sinus infection, as we explained the structure of the sinus. And very rarely, sometimes they go, instead of upper airway, it goes lower airway, meaning in the breathing tubes in the lung, and that leads to pneumonia sometimes, but that is rare. Influenza specifically, it's also, as you know, it's a virus. and we are in the season right now, it's always with a fever. They're usually more sick, cranky. They will have, beside the runny nose, they might have sore throat, they might have cough, again, because of the secretions or because of the virus itself, because it can go also lower airway. And then they might have the sore muscles. They have achy muscles. They have sometimes headache. They just feel miserable, okay? Most of the times it is self-limited, okay? But again, we still need to support them, and we'll talk about the support shortly. Also, you might have a sick contact. As I said, maybe yes, maybe no. And usually it is seasonal. Usually it's in the fall and the winter. And actually now we are in the season. The influenza gets serious, and even the regular cold can get really cause problems in a high-risk population. And the high-risk population are the kids who have like congenital heart disease, not like only a small hole in the atrium, but if they have complex congenital heart disease or in heart failure, if they have asthma, if their immunity is low, either due to a congenital disease, they're born with poor immunity, or they're taking medication or high steroids for treatment, or chemotherapy for cancer or others. And also if they have neuromuscular diseases, especially if it affects the respiratory muscles, premature kids, babies who have chronic or bronchopulmonary dysplasia, children with chronic diseases like diabetes, kidney, liver disease, cystic fibrosis, sickle cell disease, or also children with morbid obesity, like obese, they all are at risk when they get the influenza. They might not have the best outcome. So they need a lot of support. And also the kids who are on prolonged aspirin therapy for any rheumatological illness. So as I mentioned, so far cold is self-limiting, but sometimes if it gets a little bit, sometimes you may worry. And the only reason, or the few tips when you get worried is if the fever is more than 3 days. As I said, virus is usually around the 3rd day, they break the fever and the rash shows up, and then they start to get better. But if this fever continues more than 3 days, or it's really high, around 40 centigrades or 104 Fahrenheit, that's something you need to talk to your doctor or take them to the health center or the clinic. If the sore throat also continue more than 5 days, if the nasal discharge is more than 2 weeks, especially if it's green, most likely that becoming a sinusitis now. If the cough continue more than 3 weeks, because any of us, or even the kids, when they get a cold, they cough for a long period of time. But if it hits like the 3 weeks, maybe another bacteria coming and complicating it, we call secondary bacterial infection or others. Also, eye discharge with pus. We know eye discharge can be viral also, but you need to have it checked again, or there is a sinus pain. Now, if they start to have shortness of breath or fast breathing, okay, or they start to wheeze, and retractions, basically when they have pulling, I will have a picture later on. When they have retractions where they have pulling of the lung, that tells you, okay, this doesn't look like it's going the right direction, or the lips turn to blue or purple with the tongue also, that's not a good sign. Or they are so short of breath, they cannot even talk, or you feel they are so tired and drowsy and too sleepy. And the most serious if they pause breathing, which we call it apnea. Okay, so the cold is self-limiting, as I mentioned, 3 to 4 days of fever and they improve. But if things are dragging and getting more complicated, like on this slide, then these are really more than, this is a warning signs. The other part where we have runny nose will be allergies. And these are usually, we call it heavy fever, where there is no fever or nasal and nose allergy, okay? Basically, they will have the itchy nose, they keep rubbing it, or they will be sneezing beside the runny nose. And in the hay fever, usually it's clear discharge. Very rarely it's mucoid, but mainly clear, and they may be congested. The same thing, they may cough because of laying down in the back. They might have watery red eyes. And also they will have the same post-nasal drip, which basically because of the secretions laid down, it goes in the back. And usually when we look at the throat, we have the cobblestoning of the pharynx. They will be tired because the same thing like in the cold, over the night, they're having like blocked nose, they're restless, they don't sleep well. So they will wake up tired. Okay. And some might have, if it's a chronic thing, they might have the allergic shiners, which is the dark swollen swelling under the eyes. The reason for these, for the hay fever or nose allergy, is mainly the more common one is the pollen. And as you know, the pollen is seasonal, usually winter and fall. And or the dust at home. And if there's humidity, you might have some molds. Also pets, cats, dogs, and birds, sometimes people are allergic to them. And what happens if there are allergens in the environment? Basically, these small particles, which are the allergens or the antigens, they most likely are in the air. It stays in the air maybe up to 6-8 weeks, and then people just inhale them. And when you inhale them, it enters through the nose, the throat, also inside your body. Then the immune system starts to fight it and then or recognize it as a foreign body. And the immune system, whenever recognize something foreign, start to build some antibodies against it. So the body will prepare those antibodies, and also in the memory cells, what have you. Then when they're exposed again to the same particle, then the body starts to react, okay, and then releases a histamine, which causes all this itchiness, runny nose, and all these watery eyes and what have you. Okay, so usually happens in the second exposure. But for us in the environment, many times we cannot pinpoint what is the reason, which one of these is the child allergic to. Okay, and because it's related to exposure, usually it shows up on an older age, like 2 years to 5 years. So if you have, and this runny nose will be longer, it's not like the cold 1 or 2 weeks and we stop, or 1 week and we stop. This will be like weeks of runny nose. So if you have a 2-year-old or younger than 2-year-old who has like a runny nose for a long period, don't suspect a pollen. Maybe you need to investigate what else are they allergic to. Okay, so mainly the pollen related allergies peak around school age, and usually in the second exposure to the pollen, and mainly in the pollen season. Another thing I want to mention, sometimes the parents say, but he's not going outside. Okay, how it is pollen? There are many factors go into this, because we walk outside, we come with our shoes inside, so we shed it inside. Also, the other thing is sometimes it's on the car and everywhere, and we touch everything and we come home. We know kids and even adults walk bare feet. So you collect it in your feet, you come to the bed and you rub it in all the coverings and everything. The other thing, it's all over the sofa, what have you, because we are just transmitting all these allergens throughout the house. The other thing I always ask the parents when they have this allergic rhinitis, which is a nose allergy, is the bed of the child near the window. Do you have curtains? We don't wash the curtains every week for sure, right? So all of this contain, and we know Qatar is full of dust because of the construction and others. So we have to be careful where is the source and how we can control the environment. I even ask the parents if you have carpet or not, and you may need to vacuum very frequently. You might need to wash the sheets very frequently. You might have the beds covering to cover the mattress and the pillows and wash the covering. And we know kids carry their blankets all over, they stuffed animals all over, and it will be very hard to control the environment unless we have frequent washing and be very strict around it. Now, who can have these allergies or the nose allergies? We call it risk factors, but basically it happens in the families. We call them the atopy family, the family that has different kinds of allergies. For example, or the child, him or herself, have allergies. If they have reactive airway disease or asthma, if they have eczema, they have food allergies, all these factors, or the uncle or the auntie or the grandmother, someone has asthma or eczema or what have you, or food allergies. So all of this makes that child genetically predisposed to these allergies. And the other thing, if they are living in a context or in a place where there are high allergens, either a lot of pets or grass or trees or what have you, sometimes that trigger that kind of allergic reaction or having hay fever. The complication, if they have the allergies, again, because of the runny nose and the congestion, they will have disturbed sleep. So they become fatigued with low energy. Sometimes ear infection. Remember, I told you the sticking tube do drain. So with the allergy, you will also have inflammation and swelling of the mucous membrane. So these tubes get narrower and narrower, and that normal fluid in the middle ear cannot drain into the throat. So they will have the effusions, which is retention. And that's retention, you know, any stagnant water is a very, very inviting for bacteria to come and cause infection. So they can get ear infections. If they have asthma already, the mucous membrane are thickened, they have secretions, they're not getting rid of it. So it's very easy for them to trigger their asthma too. They will have poor sleep, poor quality of life, and may end up also again with the sinusitis. To prevent it is basically to avoid the allergens, be very careful and vigilant about cleaning, which is basically try to minimize the exposure to the allergens. And the other thing is supportive, keep them hydrated. And also the other thing is to give them antihistamines. And definitely it's not just over the counter. You need the health provider, first of all, to confirm it, and then give you the needed appropriate kind of management. I felt here to compare both because they share some, but in different magnitude. So the hay fever, which is the nasal allergy, as I said, it's called hay fever, but there is no fever there. Usually the mucus secretion is thin, watery, and clear. They are fatigued, may or may not have cough. Okay, and it usually happens around the exposure the second time, and it continues until you get rid of the triggering factor. While the common cold may have or may not have, but if they have, it will be like low-grade fever. The secretions or the discharge will be thicker and mucoid. It can be mucoid, mean more whitish, or it can go all the way to yellowish. They will have body aches and what have you, may or may not have cough. It's only 1 to 3 days with that kind of acute illness. And after that, they take time to recover. And the duration usually 3 to 5 days. Talking about the sinuses, because that also leads to some nasal discharge, which is thicker, mucoid, and prolonged, usually 2 weeks and more. Okay. And here is the same, very near to the picture or the graph I showed you earlier, where the sinuses, we always, most of the time, is related to the maxillary sinus, but also the frontal can be, but mainly the maxillary. As you see by gravity, the opening is not at the end here to drain it by gravity, it's up top here. So if there is an inflammation, the opening get blocked because of the swelling. And then the sinus itself has mucous membrane in it. So it is producing mucus. And then if it cannot drain it, then it will be stagnant. Secondary bacterial infection take care of it, and then it will be thicker and it will become pus. And sometimes, and maybe for the ones who have sinuses, when you sleep on the other side, like if the right sinus is inflamed, you sleep on the left, you actually feel the secretions coming on the other end because it's a matter of drainage. And that's what is the sinusitis, how it happens. Okay, the reason can be also viral, it can be bacterial, it can be due to allergy. So anything lead to increased mucus secretion can lead to sinusitis, and definitely when the bacteria secondary infection comes, then it becomes more pus. Usually the age older than 5 years, usually they have blocked nose, because remember when you have the nasal turbinate swollen, that's what you end up with the sinusitis. And usually it is a greenish secretion because it is really fermented kind of secretions. So it will be like greenish secretion for 2 weeks plus. You might feel sinus pressure, you might feel headache. And they will also have the postnasal drainage because according to the posture, the drainage can go back in the back. Sometimes you just have a bad breath because all that pus in the back. And sometimes when you look in the throat, you can see all the thicky secretions coming in the back. Okay, and they also, many of the kids or even adults who have sinusitis, you feel all the time they're clearing their throat, making all these sounds. The treatment is you treat the symptoms. Basically, if they have a headache, you give them medication like Panadol or acetaminophen and others like anti-headache or anti-pain medication. You can give them also because they might have low-grade fever, you give them also antipyretic, the anti-fever, which is the same Panadol. You might use saline drops to try to wash or the wash. Sometimes you might need to give them antibiotics. So what do we do at home with all these runny nose? As I said, the younger they are, they might not blow the nose, but if they're old enough, we can help them. Very important, hand washing, even at the level of the hospital, at the level of the daycare, not alone, even at home. When you have someone who has cold, always repeatedly hand washing. I think COVID taught us a lot, but that also for the flu. Don't focus on COVID and forget about the flu. Hand washing is very important, is the most effective way to minimize spread. I always tell even my students when they start pediatrics, I tell them, children do not like to share anything more than their viruses. So, and trust me, they also get sick. It's just a matter, very easy to spread. They're spreading it all over the place. So we have to protect them, protect us, and protect the people around us with good hand washing. If they're old enough, we encourage them to blow the nose, so we minimize the secretions if they can. For the younger ones, we will use the saline drops, which is the seawater, which is not from the sea, but it's salt and water, manufactured in a specific way. We put the drops and we use the suction. I'll show you a video at the end. If the secretions are nearby and you can pull it, you can use a Q-tip, but don't stick the Q-tip all the way in the back. Very, very important to hydrate them. So the hydration helps in making the secretions more liquidy and fluid and easy to get rid of. Because if it's thick, it's very hard to blow it out. It's very hard to cough it out. And that's why hydration is very critical. And then if you have dry air in the house or the apartment or where you live, you need a humidifier, because that's another way to help them to minimize the thickness of the secretions, to make easy to get rid of. And definitely for the influenza, we are in the season to vaccinate against the flu. I mentioned it earlier, but I'm going to repeat it with more emphasis here. When are you as a caregiver or a parent to worry? If the discharge is from one nostril, as I mentioned earlier, it can be a foreign body or a blocked nose for whatever reason there, you need someone to check it out. If there is greenish discharge, not once or twice or 3 times or over 2 days, if it's like a chronic kind, not chronic, I mean more than a week or 10 days of greenish discharge, that means it's turning most likely towards sinusitis. So maybe you need the child to be checked out. And if the fever is high and persistent, and if there is no improvement after 1 week or no improvement with all the treatments you have at home, okay? And definitely if the poor appetite continue. We know for the kids, because they're an obligate nasal breather, as we talked earlier, they might not eat well while it's acute, but after some time you should see them turn around. The kids are so, they're so cute. Once they have any kind of improved health, you see it in their energy level, in the way they walk, they talk and do whatever. So if the appetite continue to be poor, maybe you need them checked out. When to call the doctor? Again, if the fever also, even in the beginning, if the fever is not breaking out, like if you give them the Tylenol every 4 hours, but there is no improvement, okay, maybe you need to talk to your doctor. And again, very critical, because pediatrics, the children are gaining weight. So the dose you have used 2 months ago might not be the appropriate dose today. And we don't want parents to guess. So make sure you know the weight of your child, you talk to the doctor. Some may follow what is the instruction on in the bottle, but all what I'm trying to say, to give the appropriate dose for the appropriate weight for the child, because if you're underdosing, you're giving a small dose, it's not going to work. Okay, and then you fall in the vicious cycle. Is he not improving because of the illness, or not improving because you're not giving the appropriate dose on the appropriate time? Okay, so if you cannot break the fever, or it's really very high and it's not improving, if it continues more than 3 days, or there is a very drastic change in energy and feeding, and it might reach a point of refusal, because there are some viruses also can cause ulcers in the mouth, and then they cannot swallow or eat. When to call 999 or 911, or basically call the ambulance, okay? Or you go to the ER, okay? If they're breathing fast or having difficulty to breathe, or they have the grunting, which is like the sound of, you feel they're doing some pressure to breathe. Basically, they cannot open their small air sacs, so they do this grunting, or their lips turn blue or purple with the tongue, or becoming more sleepy more than usual, or they quit breathing, which is the apnea. If they quit breathing, there is no time to go to the ER. Call the number, they will tell you what to do at home until they come to the rescue. And the retractions, basically, I found this on the internet. Let me go back. So you see here, this is not malnutrition, that's why the ribs are there, because he's pulling air in. So basically, you see, I tell to simplify it to the parents, there are two signs beside the grunting, like that sound I made a minute ago, or breathing fast. Another sign, we call it retraction. Retraction, basically, because of the difference in the pressure and they're trying to pull air in, you feel the skin and the muscles are pulled between the ribs. So it feels to you as if the ribs are coming at you. And that's been like this child or this older kid here, okay? The other sign is, we call it nasal flaring, that when they're breathing, not crying, because we also, when we cry, you see the opening of the nose opens and closes, get wider and smaller. But if the child is not crying and you see the nose, the nostrils are opening and closing, like getting wider and smaller, that we call it nasal flaring. That's another distress sign. So the retractions, fast breathing, and this nasal flaring, these are the signs. Besides, if they turn blue, these are definitely all signs of distress, okay? Sometimes they breathe fast and have the retraction, but their lips are not blue. You don't need to wait. You need to get help, okay? So these are my resources. I encourage you to look at the healthychildren.org is one word, is by the American Academy of Pediatrics, is mainly geared to health providers and to the caregivers. The teachers can use it, the parents can use it, any caregiver can use it, and also the health providers. And they have it's a very helpful, and most of this material I use is from there, and there's other resources. Now I'm going to share with you this video. So this video is basically geared towards how to clean the nose for little babies. Remember, they're obligate nasal breathers. So if they have, for whatever reason, congested nose, they will be cranky, they will not eat, they will not drink milk at all. So the feeding, not at all, it will be miserable to feed them, okay? Because the nose is blocked, the mouth is blocked with the nipple, breast or bottle, they are not comfortable. So you need to clear the nose actually 3 to 4 times a day. You do it before bedtime and before feeding time. Okay, don't overdo it. Usually put 1 or 2 drops of the saline in the nostril, and then you follow it with the bulb suction. And this video to show you how to use this little bulb you get in the hospital or you buy from the pharmacies. Okay, another tip is don't jump it deep in, only the tip, because repeatedly doing that, you're creating a trauma, and that will lead to bruise and swelling, and that will lead to more block. Okay, so I'll show you the video. It's also from YouTube.
Hi, my name is Angela Hammett. I'm the perinatal education coordinator at Women's Hospital, and I'm going to teach you how to use a bulb syringe on your baby. Occasionally, your baby may spit up and need to have their mouth suctioned. Sometimes babies will also, when they get their first little cold, need to have their nose suctioned as well to help them be able to breathe better. This is the bulb that we use at Women's Hospital, and we encourage you to take this bulb home with you. And if you care for it properly, it can be used throughout your baby's first year or 2. When you go to use the bulb syringe, I always teach my patients to make a peace sign and then drop it in and then use their thumb. That way you have complete control over the bulb syringe. What you're going to want to do is squeeze out all of the air before you approach your baby. If you need to suction out both the baby's mouth and nose, we recommend that you do the mouth first. So what you'll do is you'll insert the bulb syringe into the side of the baby's cheek and go ahead and suction. And then you'll have a towel nearby that you can get all the excess out. And then we'll suction the baby's other side of the cheek and get that out. When it's time to suction your baby's nose, you can occlude one nostril while you put the bulb syringe in the other nostril. You don't have to push it up very far at all, just right inside the tip of the nostril. And then we'll get whatever's out, and we'll repeat on the other side. Once you have finished using your bulb syringe, it's very important that you take care of it and that you clean it after every use. We recommend that you clean it with warm soapy water. So what you'll do is you'll suck up the warm soapy water and then push it out and repeat that a couple of times. When you go to dry the bulb syringe, it's very important that you not store it face up because we want all of the water to drip out. So I would recommend that you store it on the edge of the sink face down. For more information or to watch.
Okay. So this is one of the YouTube kind of videos that I felt have enough information that can help the parents. And with this, I conclude my talk and thank you all for your attention. Thank you.
So thank you so much, Dr. Amal. That was a wonderful, wonderful session. I think you started off with such wonderful visuals. I think that really set the stage. I think it's so important for people to understand even, why this runny nose business starts. I mean, the poor kids suffer, like you said, the whole family suffers with them. So it's really important to understand, some of the basic anatomy. And I thought that the visuals were fantastic and sort of, explaining and helping us understand how everything is connected. So thank you so much for doing that. So we have some questions coming in, and I am just going to start with the first question. It's about when the child has cold or allergies, is it true that consuming fresh milk or yogurt, cheese, etc., may increase the mucus or make the child more sick? I mean, we hear that from the community, sometimes basically, where they tell the mothers, okay, if they have a runny nose, stop feeding them milk or stop. So can you elaborate a little bit on that, or, some myths which are there or perceptions which may be there in different cultures?
Great. Thank you. Very good question. I can share it in different angles. First of all, if the baby is breastfed and have cold, I can tell you breastfeed him. Even if you're using formula, try to breastfeed. We know the breast milk has a lot of immunoglobulins, which is like the antibodies. So that the breastfeeding, even for me, when kids, they get sick, I intensify breastfeeding. So that's one thing I can help them with. Now the cheese and the milk, and to stop them, unless the child is known to have allergies, whatever, I think he has to have a balanced nutrition and they should be fed. I don't think they should stop any kind of nutrition unless they're allergic to. And once they're allergic to, you want to not offer it to them. The other thing, they need to be hydrated. So I think it is a myth. They just feed them as normal and just make sure you hydrate them because they need a lot of hydration to be able to get rid of all these mucoid secretions.
Great. Thank you very much for that. So Dr. Amal, what would you say is sort of, the season for colds or hay fever? Is there a particular time, period in the year, or like people can think about? Is it preventable? So can you talk a little bit about seasonal changes or when you see more of this happening?
Okay, so I want to remind the audience there are two different things. The hay fever is allergy based and it's related to allergy. The commonest is the pollen, unless you have other allergens also can cause allergies on top. The cold is viral based. So this has, and both of them have its seasonality. For example, if the allergy related to pollen, it will happen when you have all the trees are blooming, and it depends on where in the part of the world you are. It depends on what is blooming when at that community or in your context or in your country. So that pollen is seasonal. If we talk about dust, and the dust is around us all the time, then it might be longer. It has no seasonality to it. Now the viruses, we know most of the viruses happen very near to the winter time, but we also know some of them in the summer. For example, with COVID, everybody in lockdown, when they came out in the summer, the respiratory syncytial virus hit a lot of kids during the summer, actually, even before the winter, where the regular time we have them, because even the vaccination for the premature against RSV happened around October, but in the summer, because now everyone is coming out and they're sharing viruses, they were like protected. So the seasonality depends on what we're talking about.
Great, thank you very much. So there's a question about the flu vaccine in children. So what is the recommended age, that when children can be given the flu vaccine?
Okay, so there are two kinds of vaccine. There is the injectable, and there is, which is like an antigen more than a live. The live is the drops, nasal drops, okay? So the youngest age for the injectable is 6 months. So 6 months and older.
6 months and older, so it would be
6 months and older for the injectable. For the oral, the nasal one, actually, which is the live attenuated, 2 years and older. And it depends which part of the world and what is available. For now, the flu vaccination in Qatar have been already started. It's highly encouraged for people to have it and to get it and give it to their children, because we cannot have two deadly kind of viruses between COVID and the flu. So at least protect the kids with the flu and the adults around them with the flu vaccine until we figure out what's going to happen with the COVID vaccine. And again, 6 months, and then the how many doses, and it's once a year, but for the beginner first time to get it, it will be 2 shots with some specific period between the two to complete the vaccination for any child between 6 months and 8 years for the first time. But if he had it the previous season, then it's just annually. So I really encourage everyone to get it.
Great, fantastic. Thank you for that, Dr. Amal. So another question, so how do you, strengthen the immune system for children, to protect them against viruses? And what about the use of vitamin D? Does it have any role, or does it have any other role, to help them with this? Can you talk a little bit about that?
So to protect the kids, improve their immunity, they have to have healthy nutrition. Okay, and healthy nutrition will be all the main micronutrients that I'm sure in your division you have been talking about it forever, and the media is full with the social media with it. So they have to have healthy nutrition. Now for little babies, breastfeeding is a blessing. Okay, so breastfeeding has a lot of immunoglobulins that will help them. So as long mom can breastfeed, basically after 6 months, it will not be nutrition anymore, it will be more immunity. So if the baby within the age of breastfeeding, if she continue, that helps. For the older kids, to build their immunity, just to have normal nutrition, balanced nutrition. There is also honey, but not less than 1 year, not ever less than 1 year. Honey also helps to break the mucus and give them some sort of immunity, and it's found to help with the colds and what have you.
Great. Great. Thank you, Dr. Amal. Again, very useful tips to have. So, Dr. Amal, can you talk a little bit about if you've seen any difference, in the symptomatology during COVID, or what kind of symptoms, have children presented with COVID, and how would they sort of different? I know you gave a wonderful visual about a common cold and the hay fever, and it really helped differentiate, the two causes of runny nose. What have you seen with COVID, or what are some of the differences?
So COVID, first of all, when it was hitting everyone, the kids had a milder illness. And because of the lockdown, they wouldn't have many kids who had it. But now I was just looking at the American Academy website, they said there are 6.3 million kids have been diagnosed. Wow. That doesn't mean all of them in the ICU. That doesn't mean high rate of death, because the disease is not as severe, but what they're seeing, the complications after, like they got COVID, they recovered, no symptoms, but later on, their immune system act up somehow and have problems for some of them. So mainly, it is mainly sore throat, liver fever, they can come vomiting and diarrhea. So the symptoms are not very specific. That's why when you suspect it, you better check it, because it might be COVID, it might not be COVID. That doesn't mean everyone get crazy and get everyone checked, but it doesn't have a very specific kind of presentation. And as I said, most of the kids are not very sick, and many of them are asymptomatic carriers. So they carry it, but they don't show it. And that's why at some point, we don't want them to be around our elderly, the grandparents, and we were trying to separate them at some point, and we still do.
Thank you very much. Dr. Amal, I know you already mentioned about, the different kind of breathing, that the children may have. Can you talk a little bit, sometimes parent, really become afraid, when they see the child becoming breathless, or like when you said, if there's wheezing happening, or the different kinds, the sounds that a child starts making. So can you talk a little bit about that, and what is really the time for them, to take the child, to a hospital or to an emergency care setting, or till when, they can look after the child at home and maybe alleviate some of their symptoms?
Okay, so thank you for this great question. So with colds, there are some sounds, right? Because it's like transmitted sounds because of, like the flute, because it's narrow, long, then you have different sounds. For the sounds I met with is like the wheezing. And some people who has asthmatic at home, they're familiar what wheezing looks like and how they breathe. The other one is the grunting, where you feel like they are breathing out again, is closing their throat. Like, this is the grunting. These are the two ones that you really need to report to the ER. Now, the other piece, which is easy for the parents to see, is fast breathing. Very simple. I know now we're using phones, but maybe use the timer in the phone, or the stopwatch, or whatever you call it, or you have the watch in your hand. Just count and see how many times they breathe. And there is an algorithm for different age groups, how much they can breathe. If they hit like the 30s, maybe you need to think about it for older kids. For babies are 40 and above, maybe. I'm just giving rough numbers. I don't want to commit to number, because according to the age, the respiratory rate may vary. So if you feel the baby is breathing faster than the usual, right, that can be a warning sign for you. Maybe you can undress them, try not to irritate them, make them cry, as calm as they are, and look at the ribs. If the same sign I mentioned, that's a sign of respiratory distress beside breathing fast. And if you see these signs, or the nasal flaring where you see the opening, closing, that's another warning sign. If you see this, it's better to have him checked immediately. Okay, that's the warning sign. If they turn blue, definitely you want. If they quit breathing, call 911 or 999 and let them advise you about how to give him breath or her breath until they land, come to the rescue.
Great.
But that doesn't mean every time they have a cold, you run to the health center. These are the warning signs.
Sure. Thank you very much, Dr. Amal. Any last final words, or any, advice? We have a large audience with us. Do you have any advice for them, regarding, or anything in general regarding children for good health?
So thank you very much. One of the things is healthy nutrition, healthy nutrition, healthy nutrition. If there is any way you can breastfeed, breastfeed. Okay, if you're not breastfeeding, that's fine. If they start to have runny nose, make sure you hydrate them. If they can blow their nose, blow their nose. If not, then use the suction with the mechanisms we just talked about. And good hand washing all the time. Those are the quickest. If you see the warning signs, then immediately call your doctor or report to the emergency room or the health center.
Great. Thank you again for that very fantastic, informative sessions. I've definitely learned a lot more. I'm sure our audience has also.